HIV. AIDS. Human immunodeficiency virus. What is HIV? Only affects humans. Disrupts immune system. Virus. Needs human cells to survive. What is AIDS? Acquired immune deficiency syndrome. Didn't have it to begin with. Immune system is affected. Deficiency. Immune failure causes symptoms. Syndrome. Defined by certain disease. Fluid that can transmit HIV. These are listed from most infectious fluid to least infectious fluid. Blood. Semen. Vaginal fluids. Breast milk. Methods of transmission. Blood. Virus must be present in the blood. Needle sharing for drug use. Piercing, home, self. Tattoo, home self. Transfusions, pre-testing before 1985. Notes. The virus doesn't survive outside the body when it is exposed to air. The virus does not reproduce like a bacteria or fungi. Blood transfusions and organ transplants. The risk of acquiring HIV from a blood transfusion today is estimated to be less than 1 infection per 450,000 to 660,000 donations. The risk of acquiring HIV from an organ transplant is similar. Before 1985, there were no tests to screen blood and organ donations for HIV. Today, blood and organ banks screen out most potential donors at risk for HIV infection in advance. They then do extensive testing on specimens of blood products and organs for HIV and other blood-borne germs. New England Journal Medicine, 1995 333 to 1721-5. Stats from the Centers for Disease Control. Accidental needle stick from HIV-infected needle, 1 in 300. 3%, or 99.7% do not lead to infection. Eyes, nose and mouth splash with HIV-infected blood, 1 in 1,000. 1%. Skin to HIV-infected blood, less than 1%. There have been no cases of HIV transmission documented due to an exposure involving a small amount of blood on intact skin. The risk may slightly higher if skin is damaged, for example, by a recent cut. Methods of transmission. Sexual, oral, vaginal and anal. Notes. HIV can enter the body during sex through the mucous membranes of the anus, vagina, penis, urethra, or mouth, and through cuts, sores and abrasions on the skin. Unprotected anal and vaginal sex are the riskiest sexual activities. There are a small, but growing, number of reported cases of HIV transmission through oral sex. When you engage in sexual activities such as the above-mentioned activities, you are also at risk of contracting sexually transmitted diseases, STDs, and unplanned pregnancy. Women are twice as likely as men to become infected with STDs, and deficiency of transmission from male to female is 4 times higher than female to male. An estimated 3 million cases of chlamydia annually in the U.S. The American Social Health Associates reports 1 in 5 people in the U.S. has an STD, and 2/3 of those occur in people aged 25 or younger. Approximately 1 in 4 sexually active teens gets an STD every year. The Alan Guttmacher Institute, Sex and America's Teenagers, New York, 1994, p. 38, yet, 68% of sexually active 15 to 17-year-olds do not consider themselves to be at much risk, if any, risk. Most, 57%, have never discussed STDs with a healthcare provider, and 70% have never been tested. 1999 Kaiser Family Foundation, National Survey of Teens, What They Know and Don't, but Should, About STDs. The best way to protect yourself is to abstain from oral, anal and penile/vaginal sex. Methods of transmission. Mother to child. In utero, uterus. During birth. Breast milk. Notes. Mothers who choose to take antiretrovirals before delivery have a 5 to 8% chance of transmission of HIV to their child. Taking antiretrovirals and having a C-section will provide a 2% risk of HIV transmission. Not taking any medication and having a vaginal delivery will provide for a 25% risk of HIV transmission. Since the intervention of antiretrovirals, mother-to-child HIV transmission rates have decreased dramatically. During 1985 to 1999, AIDS cases among children declined 81%. If the mother tests HIV positive, then the child will also test HIV positive because the child's immune system reflects maternal antibodies until 18 months of age. At 18 months of age, the child will retest for HIV antibodies. If the child is negative or positive, then that will be a true and accurate reading because at that time the child has developed its own immune system. If you have any questions regarding antiretrovirals and/or you need any clarifications, please give me, Kim Van Epps, a call, 336-9380, extension 5793. You cannot get HIV from saliva, sweat, feces, mosquitoes, hugging, shaking hands, tears, urine, vomit, swimming pools, kissing, coughing, toilet seats. Notes. It is important to note that if blood is present in saliva, tears, sweat, vomit, urine or feces, then there is a risk for transmission of HIV infection. http://www.youtube.com/watch http://www.youtube.com/watch V=3 AC Razoo 9 Kanua Extreme Home Makeover start at 1:05 and watch to 5:45. How do you know if you have HIV? 99% accurate after 3 months. Get tested. Notes: you can get a confidential/anonymous HIV antibody test at a doctor's office, local health department, Planned Parenthood and teen clinics for little or no charge. HIV antibody test involves, in most situations, 1. Giving informed consent, which may require signing a form. If 14 years of age or older, no parental consent is needed. 2. Talking before testing with a test counselor about sexual and drug-using behaviors. 3. Drawing a small amount of blood, or providing a oral or urine sample. 4. For regular antibody tests, results are given in about a week in person. HIV antibody test. HIV. Notes. Antibodies are produced in the body when there is a foreign intruder, such as when you get a cold, bacteria or virus. The antibodies or your immune system try and fight off the intruder so you will get well. After a person becomes infected with HIV, the body's immune system recognizes the virus as a foreign intruder and begins to make antibodies to the virus. Antibodies against HIV usually take 1 to 3 months to develop, rarely longer. The antibody test measures this, the antibodies, not the virus. Stages of HIV infection. Stage 1, acute stage. When first exposed to HIV. Lasts for approx 2 weeks to 6 months. Flu-like symptoms, mild to severe. Cannot get a positive test yet. Stage 2, asymptomatic infection. Dormancy stage. No outward signs/symptoms. Can last 7 to 8 years or more. Person is infected and contagious. Stage 3, symptomatic HIV, has symptoms. Common symptoms. Swollen lymph nodes. Night sweats. Loss of appetite. Dry cough. Fever, oral infections. Stage 4, symptomatic AIDS. When it is actually referred to as full-blown AIDS. Immune system is so weak it can no longer fight off diseases. White blood cell count is below a minimum level. Rapid loss of body weight. Possibly severe diarrhea. Susceptible to rare diseases, such as Kaposis sarcoma and Pneumocystis pneumonias. How to eliminate the risk. Abstain from any kind of sexual contact. Abstain from drug use. Marriage to an uninfected person and practice lifelong monogamy. Notes. Use this phrase to ease into this prevention slide. Everyone in this room with very few exceptions will be sexually active at some point in their life. These are the best ways to protect yourself and the persons you are with. How to reduce the risk: avoid multiple partners. Clean needles with bleach and water. Avoid alcohol and drugs. Don't share needles, tattoo, piercing, acupuncture. Use latex gloves and universal precautions.